Hello and welcome to the sixth in our series of videos for frontline family violence workers and therapists. Now this episode is going to focus particularly on the issues facing culturally and linguistically diverse families. And that's the last time I'm going to say that we're going to refer to that as COLD families. And this is a continuing collaboration, as you probably now know, between several agencies and individuals, the details of which can be found on the Centre for Excellence in Child and Family Welfare website. And as always, we'll be giving you a link to a whole bunch of fantastic information and resources at the end of this video. First, we'd like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to lands, waters and communities. We'd like to pay our respects to Aboriginal and Torres Strait Islander cultures and to elders both past and present. Now, if you've seen our previous videos, you'll know that some of our country's top experts have given up their time to help. And today we have two familiar faces and two new ones, very special. So we're going to start with the familiars. So first of all, welcome back, Kim.
Hi, Nick. Hopefully not too familiar. Yes, Kim Schroeder, Clinical Manager of Restoring Childhood, Intake 2 at Berry Street. Hi, everyone.
Welcome back, Kim. Lovely to have you here again. And Dr. Vibhay Rekar, welcome back again.
Thank you, Nick. Hi, everyone. I'm Vibhay Rekar. I'm a child psychiatrist and the Clinical Director of the Child and Adolescent Mental Health Service at Goulburn Valley Health in Shepparton. Thanks.
Right.
I'm glad to be here again.
Thank you for coming back. A new face, Dr. Ashima Soni, welcome.
Hi everyone, I'm Ashima. I'm a family violence case manager at InTouch Multicultural Center Against Family Violence. And I work with clients who've experienced family violence. Professionally, I'm a PhD in psychology and also registered as a psychologist with provisional registration. And my role at InTouch is to work as a case manager and with families experiencing family violence.
Wonderful, and thank you very much for being with us. Terrific. And finally, Susan, or Sue Budge, welcome.
Hello, yes, I'm a maternal and child health nurse in Laverton, which is a very large multicultural population. It's part of Hobson's Bay. Prior to that, I've worked as a community midwife in central London, in women's health in Melbourne, and spent a year in Nigeria too on my way over here, working, yeah.
And that's a beautiful Scottish accent. Where are you from originally?
No, that's a long answer. There's a long and a short answer, but not in anywhere particular. My father was from the far northeast of Scotland, in Dornoch. My mother's from Edinburgh, but we lived in Argentina as in my youth. So then the borders of Scotland, yeah.
Well, lovely to hear you, and your diction is beautiful, so we won't need subtitles. And my name is Nick Carr. I'm a GP writer and broadcaster. Our last episode was recorded at the end of July when Victoria's COVID numbers were rising. We were just beginning stage 4 lockdown. It was all a bit dire. Now we've got the start of spring. The numbers are dropping a bit. The weather's warming up. So do I detect a whiff of optimism? So let's dive straight into today's discussion. First up, we have been in this pandemic for nearly 6 months. So just want to start by asking, and Ashima, I'm going to ask you this question. Do we now have any data of what's been happening in the field of family violence, particularly around COLD families?
Yep, thanks, Nick. So the number of active cases and support period did increase during the lockdown. So with regards to COLD families and the cases that InTouch receives, it's been difficult to close the cases as clients were more isolated. And also the data compared to last August, that's in 2019, to this year, there has been an increase in number of contacts, and the case allocation cases have gone up. So whereas while some family violence organizations did report a reduced number of calls for assistance, but we are receiving a higher volume, and it's not only from our new clients, but also some of our previous clients who are isolated and feeling more anxious and stressed out during this pandemic.
And one of the things I understand is that there's actually a bit of an absence of really robust formal data, which seems a bit surprising.
Yep. So as I mentioned that the referrals did increase, but with regards to data, we do have limited data, and it's difficult to provide an exact number at this point of time.
Yeah, okay. Let's think about what the specific themes are and the learning and challenges that have emerged for COLD families during the COVID restricted period. So let's throw that question out.
Yep.
So I'm happy to respond to that one.
Thanks, Kim.
So I've been speaking to my Restoring Childhood programs across the different regions, so Northeast and Hugh Moreland, Central Highlands, and in the Mallee as well. And they've reported that there's difficulty receiving some government payments at this point in time because of visa issues. And so that's obviously exacerbated financial hardship during this time. They've had some difficulties with homeschooling and some exacerbated language, cultural, and of course the financial barriers that I just spoke about. They've had relatives overseas that they're really concerned about, so very high numbers in different countries, obviously, and having some challenges actually getting in communication with them. So that's been very stressful for some of our COLD families as well. Resources. So I actually had a conversation with Ashima the other day about this, is that even with homeschooling, so just touching on homeschooling again, is that I think there was an assumption that all families have, laptops and iPads and tablets and things like that. And it seems that while some of the schools have been really responsive in this regard, some of the other schools haven't. And also, even if resources like those have been provided, there hasn't necessarily been instruction about how to utilise them. And if English is your second language, that can prove challenging in terms of also homeschooling. So you've got mum homeschooling, English is her second language, she might have 2 or 3 little ones, and she's experiencing family violence. So the perpetrator could be in the house or somewhere in the house at that same time. They may have lost their employment, like I mentioned earlier. There could be those financial issues. So it can be a bit of a pot ready to boil over, is what I'm hearing from some of the clinicians in the family violence space, especially. There's also some of the things that have been reported is the impact of racism. So the things that are going on, both in Australia and around the world at the moment, are quite, very significant. It's a very significant point in history. And that's certainly impacting on some of our COLD families, or all our families, but, in particular our COLD families, and Aboriginal families as well. And then there's also, there has been some challenges in actually accessing interpreters as well. So depending on language, there's been a shortage of interpreters, and also adapting work to not just telephone, but to telehealth as well. So working in that Zoom space. There's been a lot of work done by Restoring Childhood with some interpreters, but we have found some challenges on the way in that regard, just not having access to certain languages, which makes it really difficult and not ideal in the therapeutic space. So we might be working with children where we'd just be working with children one-on-one, but because of the lack of access to a particular language interpreter, some of the children are now doing that interpreting, which is not ideal in the therapeutic space. So those older children, that responsibility falling on them, which is not that is not just, that's not just because of COVID-19. That does happen sometimes, but you do often have better access to interpreters.
Wow, that's a huge number of issues that are brought up, and at least 3 that I can remember. Talking about issues with visas, talking about issues with technology, how to use them, issues with interpreters, the problem how all these combine when you've got maybe a perpetrator at home. Let's go to the first one, a bit about visas. Tell me about the visa issue. What's been other people's experience with concerns around visa issues?
So Nick, because like InTouch works with clients from migrant and refugee backgrounds, and at InTouch, approximately 60% of our clients are from are on temporary visas, and some of them do not have any access to government support. So when I say temporary migration visas, they could be on student visas, they could be on spousal visas. So, and I'll just give an example, like if a client is on a student visa, she's experienced family violence, she's lost her job, and she has no money to pay her rent. So she's got no support from anywhere, and it's becoming very difficult for our clients with no government support, particularly if they're on a temporary migration visas. And so if the client is a newly arrived migrant to the country, and there is this migration stress because she's left her own country, joined a new partner in this country, and she's experienced family violence. She is not aware of her rights and responsibilities. And then this country went into the lockdown and pandemic started. So family violence has been like an epidemic for that client in this pandemic, because she's not aware what comes next. She's lost her job. She can't go to the college. She's isolated. So there are a couple of issues, and some visa is a major issue, and the lack of income support for our clients. And also, a significant portion of our clients, as I mentioned, they are ineligible for any Centrelink payments. So, and then they face multiple and varying layers of disadvantage, because we've been contacted by a large number of women who've lost their source of income as a result of their businesses being shut down or being restricted. And that is why, like, there's a huge financial burden for temporary visa holders. And also because, and that is why they're facing like severe financial hardship during this period of time.
And Sue, has this been something you've seen with your CALD community in Hobsons Bay area?
Absolutely, I can second what Cecila is saying. Many of my clients are in extraordinarily severe financial circumstances. I mean, the examples of one family who were eating potatoes for 2 weeks, they could afford nothing else. So his mother had come to me complaining of severe constipation, and it was only by unpacking it that I realized that they'd actually had no money whatsoever. And so we're, as a council, as our service, we're piecing together little bits and pieces of funding to help these families, but it may amount to, you know, a voucher here, a voucher there, getting help with half their reducing their rent. But that really is it. I mean, these people already come from a situation where their employment was terribly tenuous anyway. They're working as Uber drivers, they're working in hospitality and things like that, underpaid, overworked, and now lost that meager source of income. So they don't have savings to fall back on. They don't have a nest egg to fall back on. And throw into that also within the early childhood, just talking in terms of family violence, women who've recently had babies would often have brought mother or mother-in-law over from another country to be with them. That's not happening. There's no buffer. There's no buffer for them there within their family home, and that sense of family support. So they're very, very isolated.
It's interesting to hear you say, so a voucher here, a voucher there. It sort of sounds like the old joke about social work of handing out vouchers and tickets. But we've talked before in these webinars about how sometimes our interventions have been pared back to the more simple, more prosaic. And it sounds as though sometimes that's maybe what we have to do. Vive, I'm going to give you a curly one here as the child psychiatrist. We've talked about all the issues, all the problems that CALD families are facing, how they're increased and stressful during this time of COVID. Sue's talked about vouchers as a very simple, pragmatic and effective means of support. But what else can workers do? How can we help these CALD families during this really tough time?
Nick, I think like with all that's been said, we know there's a lot of stress and pressures on these families, but I'm thinking about the workers, especially who go out or who are in the process of working with these highly stressed families and the stress levels they are going through. And I'm wondering about, this push to feel, to move fast and effect change quickly. And I think the challenge sometimes with cold families is that, they the engagement might not occur. There might be the engagement failures, or we have a sense of, oh, things aren't moving as quickly as we want them to, or we're not able to engage, or the family is not able to engage. So I think it from my perspective, I think it's really important to keep that in mind, and to think about how does it feel if they do not readily accept our services. How might we understand this perceived lack of engagement? And I think we, and to think about all the factors, such as the multicultural factors, such as race, age, socioeconomic status, and how does that affect our perceptions and our responses. So there is sometimes, I think it's important to step back and to think about what is going on at this time, in this situation, and how can we try and slow things down. And maybe, the engagement might take a bit longer. Maybe things might not progress as we want them to. And I think it's a really important bit. Once the engagement occurs, and that's really strong, then there's a lot of movement that can occur. So I think it's important to think as teams, as managers, as clinicians, how can we, if we're not able to get some movement or things are feeling stuck, how can we, use the thinking within the teams to be able to make those changes and push things forward, maybe at a slower pace.
I really like what you're saying about sitting back a little bit, slowing things down, considering it. And again, we've talked before about paring things back and maybe sometimes simplifying a bit. Do others want to comment on that as well? Because I love that concept, Vibha.
Yeah, well, just adding to what Vibha has just said, I've been speaking to some of my family violence colleagues that work in case management in some of the high risk family violence programs. And exactly what you're saying, Vibha, is that they're saying things are taking longer. So the practical support that they would usually provide to families, things like going to the police station and supporting a woman to make an IVA application, things like going to the police and making a statement before the IVO application, practical things like housing applications and things like that. They're all taking longer because they're not able to do that face to face. And like I mentioned earlier, some people don't have the resources to be able to do that electronically. So we have had to slow things down a lot and really consider the best approach to take with families. And we don't always get it right. That's the thing. I mean, we don't get it right. So there's been lots of learnings, over the past nearly 6 months, feels like longer in COVID-19. But yeah, there's been lots of learnings, but definitely Vibha, you're right. We've had to slow things down in terms of what, court processes, police statements, housing applications, things like that could be usually done in a couple of days, sometimes taking weeks at this point in time. So it sort of adds to what Ashima was saying earlier, is that the engagement with clients is lasting for a longer period of time, or clients that had closed have now re-engaged, or clients that were, due to close sort of around when COVID-19 hit Victoria at the end of we're looking at closing at April or May, that now they're still open because of these reasons, because these processes are taking a lot longer.
So, sorry, Ashima, go ahead.
No, sorry, I just wanted to add to what Kim said, because there can be of course, all families do face some additional barriers, could be language, housing, immigration issues. But with this COVID, there are more additional barriers. I'll just give an example. So our client might not have an access to a laptop. She might be eligible for Centrelink payments, but language is a barrier. So in the past, the client could come to our work, I could assist in filling in the forms or accompany the client to the Centrelink office, assist, but because she's got no laptop with the restrictions in place, she can't go out, she can't report on time. That's impacting her ability to get the payments. So it's just like, it's getting very difficult with regards to certain additional barriers. And also, I've also felt in with my clients that there is this restricted ability to seek help, because sometimes the perpetrator is at home and it is very challenging as a worker to reach out to the client when she is staying with a perpetrator of family violence.
I want to channel my inner Wendy Bunston here and bring the baby into the room. Sue, I want to ask you this question, and we've touched on this in previous videos, but it's hard enough sometimes to keep the baby in mind, even when the baby's in the room. So how do we do this in this really complex environment with the combination of COVID, telehealth, cold? How do we keep the baby in mind, both physically and intellectually?
Absolutely. And, you know, there are several areas that are more difficult at the moment. It's no easy answer to this one. With telephone contact with families, then, you know, keeping the baby in view and in mind might be talking for the child. So say there's been a family violence incident and the mother's expressed that to you, and you might say, oh, little Jack must have been so frightened, bringing back some sense that Jack was also affected by the shouting or whatever the issue may have been, and bringing that sense of, oh, maybe sometimes it's an awareness that the baby may also have been affected. This might be the first consideration. There's so much on a woman's mind in that issue of violence, that sense of keeping her baby safe may be a sense of making sure he's fed, clothed, and reasonably happy, but not having considered his emotional and well-being and his sense of being involved in the violence and a victim of that violence also. We are seeing babies face to face, in some families face to face, but in you know, with a mask and a visor, and so that limits our ability to interpret and work with babies who are responding differently to this strange looking face. So if we are talking to the baby, it takes longer, and of course we are bound by, you know, as you might be too, limiting our consult times too, so that's tricky. But you know, in a sense, we use the same approach of bringing the focus back to the child at times when it feels appropriate, and that can be a tricky judgment, because you don't want to add a sense of increasing burden or guilt to the family there too. So you have to pick your time and timing with that.
It's an odd quirk of this time, isn't it? That sometimes video conferencing, where you can actually see faces because
Yes.
you're not masked, is going to work better. Because I'm finding this when I see a baby face to face. I've got my own spectacles, I've got
Yes.
a face mask, and then I've
Yes.
got an eye shield, and the baby's looking at me as if I'm something from outer space.
Yes. So generally our experience has been that we've not been using video conferencing with many families. They've not either accepted that as an option, preferring a phone call, or they may not have the facility to take a video call. We do, yeah.
So another question arises for people who are watching this who may not be specialists in family violence. How can we help more generalist workers who strengthen their family violence lens and practice when working with cold families? That's a really curly one. Who's going to try that one? Vivek?
Look, I'm a very I believe in supporting our workforce well, and because they're the ones on the cold face. And one of the things that struck me, and I'll just quote a study from 2003 by McGuigan. So he found that the caregivers odds of remaining in a home visiting program for at least a year increased by 79% for every 1 hour increase in monthly supervision the home visitor received. So I think these are such stressful times, and we know with engagement there is a challenge with called families, and I think if the clinicians, the workers have good supervision, and if that's an ongoing thing, and even by increasing by 1 hour a month can cause such a huge change in engagement, then I'm all for supporting that. And so I think we need, as organizations, we need to start thinking more about how best we can support our frontline workers and put those processes in place where, you know, they can do their work, and this is complex work. And so so that would be my push for increase. And I know this might tie in with some more discussions later on about more resources, but this is what I feel would really help.
I think that's an incredibly potent point, Vibhay, and supervision is something which seems to be a bit in the zeitgeist at the moment. But to have some research that shows that just an hour a month of supervision makes such a tangible difference to outcomes, I think is really potent. So maybe one of the messages out there to organizations or individuals is crank up your supervision. And if you're not getting it as an individual, go to your organization and say, it's about time we had some. Because we want to talk a bit about collaboration. So does anyone else want to touch on that question? Because I think that's very important.
Yeah. I think, Nick, because it's really important for the non-specialist family violence workers to take time to explain about the factors like risk, safety, family violence, because certain call clients might have no idea about when they are being asked, are you feeling safe? So the client might say, yes, I'm safe, but what exactly is the definition of safety when we are talking of family violence? So in context of family violence, and asking open-ended questions, because with call families, the abuse might be minimized because there might be shame and stigma attached to discussing certain aspects, and engaging female interpreters, because for certain communities, talking about certain aspects, for example, sexual assault, it's very uncomfortable for a client to discuss about sexual assault with a male interpreter. So engaging female interpreters, and also I think it's absolutely okay for a worker to ask from the client if they are not aware of their cultural background. For example, I work with call clients, but I might not be aware of all different cultures. I might not be aware of what are the intricacies of different cultures. So I have got clients from Indian background, and they discuss about arranged marriages, they talk about dowry abuse, and there are other clients who talk of forced marriages. I might have an idea about things which are relevant to my own culture, but things which are not prevalent in my own culture or which I am not aware of. I believe it's absolutely okay to ask the client to have a more understanding rather than making any assumptions with regards to it. And also building rapport and trust. I think that's very important for a worker to have that trust and building that rapport. And also practitioners also should be aware of their own race-based assumptions, and should also adopt a human rights framework, which is like, example, how equipped are their organizations and services to work with women from CAL backgrounds. And I think and also reinforcing the fact that violence is not a cultural issue, it happens in all cultures. So just to say, and to have that kind of, and then encouraging the client to seek support and help where available, when available. So these are points, and I think, Kim, if you've got something to add with regards to the shame and stigma that I was talking in terms of clients from CAL backgrounds in seeking support from from the workers from callback. Sorry, I mean to say that if there is any shame and stigma for clients from call backgrounds, if you've experienced that ever with any of your work.
I certainly have. I used to manage an Arabic-speaking family violence program in Hugh Moreland, and basically we experienced a lot of stigma in regards to family violence. So first and foremost, we ended up with the highest proportion of self-referrals into the program, which I thought was interesting. But of course, most of those women stayed in the relationship because it was too unsafe, too dangerous for them to leave that relationship. And I know that the feedback, from a lot of those clients were that, they felt a lot of stigma attached to seeking services, to naming that it was a family violence service. So they often wouldn't. Often they would tell their friends or their communities that they were seeing a playgroup or a family services worker or something like that to do with the children. And that was also, obviously, when we safety planned with some of those women, it was safer to do that in case, the perpetrator of violence was actually listening in or had people that knew that she was seeking services, that they'd ask the children as well sometimes, so that if the children come into the service with mum, they'd ask where they had been during the day, what appointment they had attended, what the worker was doing, and, they would ask what sort of language was used. So definitely a lot of stigma attached, very difficult. And I do worry, Ashima, about those communities at the time, because I do think that was really, they were able to access services face to face, and it was a huge step for them to take, and really, incredibly important in terms of safety planning and getting to that point where if she did want to leave, she had a plan, she had supports around her. And it, in the virtual world, while it's better than nothing at all, it's not the same thing as face to face.
Yeah, and also just to add to that point, because there is also this fear of deportation for women from CAL backgrounds, because if she is dependent on the perpetrator's visa, that also adds to the uncertainty and a barrier in seeking support, because she might have been informed that if you approach the authorities, I'm going to deport you back to your home country. So the women is scared to seek help because of that, or she might be told, no one is going to listen to you because I've been here for so many years. I'm going to keep the children and I'm going to deport you back to your home country. So there's this fear of being deported as well, which is another aspect that worker from a frontline worker also needs to explore with the client about her visa issues.
And one of the things I've heard you both say, which I think is crucially important for workers in this area to understand if they don't already, is that you cannot be and shouldn't be expected to be an expert in every aspect of cultural background for people from cold backgrounds. And the right thing to do is, as you were saying, Ashima, is to ask and get people to tell you about it. I think that's a really lovely point. In some breaking news, just yesterday afternoon, the Victorian government has pledged over $14 million to better support multicultural communities. So a bit of cash to splash. From the conversation we had earlier with Vibe, I think what we should do is spend 14.2 million of that on supervision. But I'm going to ask you first, Sue, if you had $14.3 million in your back pocket to spend in this area, what would you spend it on? Where should it go?
Oh, well, my personal political opinion is that the excluding of non-residents from JobKeeper and JobSeeker was a huge error, and that other countries haven't, have done better with that. And I'd love to see some of that money going towards just basically getting these people off a complete poverty line. But yeah, certainly supervision for sure, yeah, perhaps, but I'm not really sure. I'm so much with these families on a day-to-day level who are telling me how little money they have. That's where I'd love to see that money going. Yeah.
Probably wouldn't do any harm to get some leaflets translated accurately into other languages. Vibhay, what's your view? You've got 40 million to spend. Where would you put it?
Look, that's such an important question. I think again, I'd go back to my workforce, supporting our workforce to do the work, and I think there's so much that can be done. I would like to mention about the diversity-informed infant mental health tenets in case, I think, and we could give a link to that, because again, training the workforce on, how do we work with culturally diverse lens when we're working with this group. I think it's so important. And my focus would be on workforce support, training, supervision, and just strengthening the systems so that they can respond better to the challenges that we face.
Probably wouldn't do any harm to give a bit of assistance to people with all these laptops and how to use the things when they've got them. Just before we close, Kim, what would you be doing with the money?
Well, I was doing a bit of light bedtime reading last night, Nick, in regards to that release of funding. And I like that they are going to release, 6.9 million to organisations on the ground. So I hope that that includes outreach services, because I would definitely prioritise outreach services for all families, including COLD families, obviously. And I would make that a focus now after, sort of what I said about the Arabic speaking family violence program that I managed, because I do worry about those families. 2 million is going into translation, interpreting services. So you'll be pleased about that, Nick. And 5.5 to expand on how those translations are distributed from that 14.3 million is what's being said at the time. But they are going to implement a COLD communities task force. So hopefully you'll have some COLD representatives, if not all COLD representatives on that task force, so they can best decide how to spend that money.
Well, you four would be looking out for a phone call from the state government in that case.
Sure, no doubt.
Well, look,
and before we finish, Nick, can we just do a shout out to the Orange Door?
Oh, of course, thank you. Yes,
yeah, Karen's not here, so I feel like I need to do it on her behalf.
Yep, so just a reminder that we always stick a little orange theme somewhere into these videos, just as an acknowledgement of Orange Door. Thank you. Does someone just want to explain, if someone doesn't know, what Orange Door is?
So the Orange Door are the family violence safety and support hubs.
Right.
So shout out to them, because they're doing some amazing work in very challenging times.
Oh, my dog has just decided to join us for the end, so I'm still channeling my inner Wendy Bunston as we come to an end of this particular video, because that's all we have time for today. So thank you very much for joining us. Please stay online to give any feedback or leave questions that you'd like addressed in future videos. And as Vibhay mentioned, you'll find a whole host of valuable resources on the event page for this at the Centre for Excellence in Child and Family Welfare website. So that just leaves me to thank our wonderful experts who've given up their time to do this today. So Kim Schroeder, Vibhay Rekar,
thank you.
The dog's typing down, Ashwa Sonny,
Thank you.
and Susan Budge. Thank you very much. Thank you for being with us. I've been Dr. Nick, and we look forward very much to having your company next time. And Rosie will say goodbye too.
Thanks, everyone.